Hello, my friend. It's been a while. Welcome back. It's good to see you. What brings you in today? Another cranial nerve exam. Is there a reason for this one this time? Or just a checkup? A lot of stress and anxiety lately. Other doctors can't figure out what's going on. I understand. That's okay. Well, you know what? Today we're going to check you out, do a really easy exam. It's just going to be testing your sight, taste, touch, and sound responses, okay? You've been through this before. Very easy. Why don't you go ahead and just sit down right there for me. Get comfortable while I glove up, and then we'll get started, alright? So, while I get these gloves on, you tell me how long you've been experiencing heightened stress and anxiety levels? A couple months, okay. And are these bringing on anything that's interrupting your life? Sleepless nights, panic attacks, inability to get things done? Sleepless nights, okay. Well, that's not good. Healthy sleep is a vital part of a healthy lifestyle. So we obviously want to get to the bottom of this and make sure we get you all fixed up. Alright, it's all going to be okay. I'm sure it's nothing serious whatsoever. So, now I'm gloved up. I'm just going to do a quick examination of your scalp and your face real quick just to see if there's any glaringly obvious problems, and then we'll get into a little more detailed work, and then we'll get to work on those eyes, that nose, that mouth, and then your sense of touch. Alright? Alright. So stay still for me. Look right at me. Right at me. Okay. So I'm just going to come over here. Just look through your hair a little bit. Just look for any bumps, lumps, cuts, any contusions, abnormalities, anything that might be a concern. Here, let's see. Not seeing anything concerning, which is wonderful. However, since you are here on a referral from another doctor, I do want to be thorough. So I'm just going to take a few facial measurements and measurements around your head just to make sure everything is lining up where it should be normally and that we're not missing any kind of slight abnormality, okay? This will not hurt one bit. I'm just going to use my calipers here. See, they just slide just like that. Very gentle. Gives me measurements so I can see and make sure that everything is where it's supposed to be. So again, stay still. Just look right at me. And I'm just going to take a few quick measurements, okay? Alright. So we're going to turn this on. There we go. First one, I'm going to measure temple to temple, okay? So stay very still here. Okay. Good. That's right in line where it should be. Now I'm going to measure the distance of your eye. Really quick. Good. That eye is perfect. And let's check this one over here. Little adjustment. Good. Now we're going to check the length of your nose just to make sure that's falling right within the average percentile. Very good. And then can you just look at me with a neutral mouth? Good. And give me a big old smile. Big grin. Gonna check that. Great. Well, everything looks normal, which is wonderful. Nothing glaringly obvious, and if there's nothing obvious, means it shouldn't be too much of a problem. If there is any problem, which I doubt there is. So, now I want to test your vision. So we're going to do a couple quick tests here. Alright. The first one being, I just want you to simply look straight at me. I want you to follow my finger. Okay? All right. Here we go. And just follow. Good. Very good. Good. You're doing wonderfully. Good. Great job. And now I want you to close your left eye for me. All right. And we're going to do the same thing. Just follow my finger. Just with your right eye there. Good. Just follow it. Good. Good. Now I want you to close your right eye. And same thing. Follow. Good. Follow. Good. Wonderful. Okay. Now I want you to open both eyes for me. Good. Straight ahead. Now we're going to test your peripheral vision. What I want you to do is let me know when you can see the fingers come into your vision and when they go out of your vision. All right? And here we go. Good. Wonderful. Good. Good. Let's go this way. Great job. Good. And there you go. Wonderful. And just for fun. Good. Great. Good job. Awesome. Perfect. Peripheral vision looks intact. Your favor. Look at me. Straight at me. You see the wiggling finger here? No? How about over here? No? No? Good. Same thing over here. Look at me. Good. Good. Wonderful. All right. So, let's see how your eyes do with a little light. What we're going to do first is I'm just going to test your eyes' light sensitivity by doing what's called the swinging light test. So I'm going to cover one of your eyes and I'm going to swing the light in and out of your line of sight in your open eye. Just going to be checking your pupil dilation, make sure that there's nothing wrong with that optic nerve, okay? All right, so here we go. Just going to cover. And here we go. In and down. 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 Wonderful. And on this side, same thing. In, out, in, out, in, out, in, out. Wonderful. And I'm going to check your eyes with a little bit of a brighter light. For this one, I want you to keep both eyes open, and I just want you to follow my light here, okay? So, I'm just going to scoot over a little bit to give a little more room, and I just want you to follow the light for me. Just keep following it. Good job. You're doing so very well. Good. Bring it in, and then out. In and out. In and down, and just keep following the light for me. You're doing wonderfully. Good. And over here, there we go. Good. Good. out over here, and in, down, and in, down, and in, and down. Great. Well, my friend, your eyes seem to be working very well. I just want to do another quick check. I'm going to look into your eye itself this time. So I'm going to have to get a little close. I hope you don't mind. Just going to use my magnifying light here. So I'm going to scoot up and I want you to open your eye for me. I'm going to look inside and just follow my instructions, okay? So listen to what I say. Do as you're told. Okay. Good. Good, good. Now, why don't you look up to the left for me? Good. Now the right. And down. And up. Good. Check the other side now. Alright, same thing. Look to the right. Good. Now to the left. Good. Now up. Good. And down. Good. Very good. Not seeing any issues with the optic nerve back there, which is great. Now, just to round out this part of the eye exam, I'm going to just palpate gently around your eyes. Please let me know if there's any discomfort. Again, this is just to check, be thorough, and make sure that there's nothing wrong. But I'm not seeing anything, any discomfort so far. No, good. Good, good. Wonderful. Alright, well, I think your eyes are just fine. Maybe cut down on the screen time a little bit if you're looking at your phone before bed a little too much. We all do it, I know. It's easy just to keep scrolling. But sometimes you just gotta set the phone down, let the mind unwind and relax, and go to sleep. So, your eyes look good. How's your sense of smell been lately? No issues? Okay. Usually a loss of smell is a pretty indicative issue of a bigger problem, but if there's no issues there, that's great. Alrighty, so why don't we move on to your ears next? We're going to take a look inside, do a couple hearing tests, make sure that everything's working properly, and see if there's anything that might be causing those headaches and that stress, right? Okay. So I'm just going to pop on my otoscope attachment here. Just like that. So I'm just going to go ahead and shine this into each of your ears, looking to see if there's any blockages, if you need a cleaning or anything. Alright, and see if there's any inflammation, any redness, anything like that. Alright, so hold still for me. I'm just going to come over here, just going to gently slip the otoscope inside. And let's take a look here. Wow. A little bit dirty. Tympanic membrane looks good. It's pearly. No redness, no inflammation. Not seeing any kind of damage, just a little wax buildup. Alright, so as I said, nothing looks too bad over there, just a little waxy. Check your other ear now. Again, same thing, just gently putting the otoscope inside. Just looking for any inflammation, not seeing any. Eardrum looks good. Okay. So you said you've been stressed lately. In these heightened states of stress, have you ever noticed a loss of hearing? No. Alright. Good. So we're going to do some quick hearing tests with you. What I'd like you to do is just close those eyes for me. And I'm going to make a sound in one of your ears, and I'd like you to tell me which ear it was. You can do that by saying right or left, or you can just raise a finger on the side that you hear the sound, okay? Alright, so go ahead again. Close those eyes. Let's begin. Good. Good. Good job. Very good. And if you do hear our therapy dog snoring, that's just because he's taking a nap. He's had a very busy day. But maybe you'll be relaxed after this exam to take a nap yourself. Good. Very good. Wonderful. All right, you can open your eyes now. Good. Give those a couple blinks. All right, because we're going to ask you to close those one more time. And this time I'm going to whisper a word in your ear, and I'd like you to repeat it back to me, okay? All right. So close those eyes, and let's begin. Relax. Good. Pancake. Good. Vacation. Good. Dream. Great. Coconut. Wonderful. Pineapple. Perfect. Go ahead and open your eyes for me. So for the final part of our exam, we're going to be moving on to testing your sense of sensation. I'm going to be touching you a little more during this part of the exam. We're going to be testing your reflexes as well as your sense of touch, okay? All right. So first things first, we're going to start off with those reflexes with my little reflex hammer here. So I'm going to start at your knee, all right? And you let me know if you feel any discomfort. I'm just looking for that automatic reflex, okay? And 1, 2, 3, and good. The other knee. 1, 2, 3. Wonderful. Now I'm going to test your elbow. Just give me your arm real quick. And 1, 2, 3. Great. Other arm. 1, 2, 3. Great. And the wrist. This is just a very light tap. 1, 2, 3. Great. And the other wrist, very light tap. 1, 2, 3. Great. And one last one. This is called the jaw jerk test. Just going to put my thumb here. Give a slight tap, okay? Just be very, very, very still. Look at me, look at me. 1, 2, 3. Wonderful. That's it. It's all over. All right. Look straight at me. Before we get into testing your facial nerves and other sensation, I just want you to do a couple muscular exercises for me, okay? All right, so look straight ahead. And I'm just going to go ahead and feel your jaw here. And I want you to clench real hard. Clench down. Good, good, good. One more time and squeeze. Squeeze real hard for me. Good. All right, now puff your cheeks out. Good. Big smile. Good. Big frown. Good. Raise your eyebrows. Good. Go like this. Good. Clear your nostrils for me. Wonderful. All right. So we're going to go on to test your sense of touch. This is a very simple and relaxing part of the exam. Very easy. All you have to do is close your eyes and let me know if you feel the soft object or the dull object on your skin. I may be touching different parts of your face and your neck. Okay? So why don't you go ahead and close those eyes for me. Very good. And let's begin. And touch. Soft, wonderful. Touch. Dull, very good. Touch. Soft again. Touch. Dull, very good. Touch. Soft. Touch. Soft. Touch. Soft again. Touch. Soft. Oh, that last one was dull. That was on me. Touch. Dull. Very good. Touch. Dull again. Touch. Good. Soft. Touch. Good. Dull. All right. Go ahead and open those eyes for me. Well, my friend, I have to say, I can't really find anything wrong with you. You seem to be in perfectly healthy shape. But the other doctors in this practice might not agree with this. But sometimes herbal remedies can be a little more of a effective method for some folks. So I can write you a recommendation for a very good herbal medicine doctor. He doesn't reside in this office. He does have a private office for his patrons, but I will send you over to him with a great referral, and hopefully he can get you settled with something that might be able to help you sleep a little bit better. But if not, I really do suggest drinking a little water before bed. Take about an hour away from the phone and all screens before bed. Lay down, quiet, calm, dark area, and just let your body naturally fall asleep, okay? And anytime you need us, please feel free to call. We'll be more than happy to see you. We'll see you soon. Have a great day. Bye-bye.